where I can kind of like kneel on the edge. Awesome. Okay, so when patients have a knee fracture or a knee injury, they're actually very, very bent. Okay, there you go. And so I would check CSM before and after. Okay, but I'm going to check CSM real quick before. Okay, and pulse is present. Can you feel me touching toes? Can you wiggle them? Great. So here's a couple of tricks. The board goes low on the patient's hip, okay? And I want the long side down here, okay? And I want it on the same side, just like that. Some of the mistakes I've seen students do is that they have it way up here and it's way like this, okay? We don't need to do that. So again, I get you to hold the boards. So I'm going to grab one cravat. This cravat is going to go underneath the knee. It's going to go between the body and the two boards. Okay? Does everybody see that? And then I'm going to tie it on the patient's side. And the trick is to make this thing super tight. Can I have some gauze, like a roller gauze real quick? Since it's kind of more of a rope, can you put that there? Because I don't want to accidentally touch it. Okay, make it super tight. I have really horrible, well, I've been saying that right all day long. Okay, the next one is really kind of simple. I'm just going to throw it and go over the boards and the leg. Do you see the X? Because remember, I don't think, I'm sure we said it, X's are important, okay, right? So do you see the X on this side? Do you see the X on this side? X's are there, okay. Awesome. So the next one, I'm going to put underneath his knee for now. And then this is where the trick comes in. I'm going to be in your way. Okay. So if I were to just leave the foot here and kind of just tie it all together, then when we put him on the stretcher and as we bounce into the hospital in the back of an ambulance, it's going to jiggle and it's going to hurt him, okay? So I want the ankle off the foot. Now doing this, look what's happening to the knee. Doing it, I'm basically moving the knee. So I'm going to grab the foot, grab the boards, and I'm going to bend them or move them at the hip, okay? I'm bending them, moving at the hip, sliding the boards down, doing, okay, there you go. And I'm going to use my knees to support the two boards. I'm going to bring this cravat down and kind of create a basket, okay? I'm going to twist underneath, or not twist, crisscross, and then crisscross on top. We're not really crisscross, but tie it on the side. And then the last one, this is going to be kind of complex. I created this little this little tie. So I'm going to go underneath the foot, but on top of the board. I'm going to crisscross underneath the leg. I'm going to crisscross on top. And then this is going to go on both sides between that and that. And then I'm going to tie it. Preferably on the side, but I'm going to just put it on top. Okay? And then I'm going to check CSM. He should not want to even, but he should not be able to move the knee. Okay? He's doing it because this is not tight enough. It's a rope, really. Okay? Any questions about that?
So the top part has to be extremely tight in order for him not to be able to move. Okay.
It all needs to be really, really tight. Otherwise, he's going to be able to bend it.
Okay.
Go ahead and, not bend it, straighten it out. Okay, he's not going to want to. He's not going to want to because it's broken, right? Or it's injured. But because it's not tight enough, that's why he can do it. Okay? Just, okay, cameras are off. Cut that part out of the